A fundamental issue for us is to do no harm. I think it means more to me than some because I was harmed in a hospital in the 70s. I was having an orthopedic procedure and got a staph infection. And it's the sickest I've ever been in my life and really prolonged my recovery. And I think that's why in our own hospitals today, infection control is just a huge issue. And I think it's for other CEOs, for myself, I have to not just say other CEOs, for myself included, we have to have reminders that our personal involvement in patient safety is key. When people know and watch us, they see what's important to us.
Through the Partnership for Patients, the biggest thing that I've learned is to be present, be involved in patient safety. As CEOs, wherever we dedicate our time is where emphasis will be placed within the organization. So we need to be there in every situation where we're discussing, impacting, studying, divulging all aspects of patient safety information.
Every day I have a purposeful conversation with an IU Health employee who's personally involved in care delivery. For instance, today, first thing in the morning, I talked to the staff that deals with hospital-acquired infections at one of our larger hospitals to ask them how things were going and how senior management could help them do their job. Every week, I round in a given area of one of our hospitals at Indiana University Health, from Goshen to LaPorte, all the way down to Paoli or Bedford, on safety rounds to see if there are things where senior management can be helpful, assets that need to be deployed, education that needs to occur at the local level that can help me understand how to help our staffs do their jobs better.
We have to make sure we're bringing in those that are on the front line day in and day out as we look at opportunities to improve, getting them engaged in the work and the changes that need to occur day in and day out. It can't be something that's only top-down driven. It has to be certainly supportive and driven from the top, but we've got to engage workforce, whether it's bringing them into meetings on process improvement, other activities. Perhaps we have an event or a near miss. Are we bringing our workforce in and really talking through what occurred, what can we do differently, and really engaging them in the improvement activities we have around safety issues.
As a leader of the organization, you have to have the vision. You have to create a culture that says safety's number one. We all know, unfortunately, bad things happen in hospitals. When those things happen, we're very transparent. We share that out with our entire staff. We share it with our board. We share it with our community. So we allow people to know that when things happen, we get together and we have a conversation about what could we have done to have prevented it, and how do we keep it from happening to the next patient.
I think it's important that every CEO participate in this partnership because in the end, nothing's more important than safety in our hospitals, and secrets should not be kept. They should be shared amongst all hospitals so we can all have a safe environment for our patients, our visitors, and our employees.
A couple of the things that we do to address safety on a daily basis are the daily safety call. We have a daily safety check-in at 9 a.m. every morning, 7 days a week, and we talk about every safety event that might have occurred in the last 24 hours and anywhere where we think we're at risk for safety issues in the upcoming 24 hours. When we first started the daily safety call, no one wanted to do it. They thought it was a waste of time. Within a year and a half, on a survey of the same leadership, they indicated it was the #1 best thing we had ever done for safety, that it allowed them to bring in the support people they needed to have at any point in the day to address anything that might put a patient at risk, whether it could be a computer issue or an equipment issue or a staffing issue or a knowledge issue. The whole team was there to help them address that.
Probably the biggest results we've had is that we've now gone at Clark Memorial Hospital for over 24 months without a ventilator-associated pneumonia case. We've also had about a 50% reduction in our falls rate due to some initiatives put into place through a process improvement team. And the other thing would be that we've had a dramatic decrease in our special care deliveries because of our no deliveries before 39 weeks.
We've seen pretty significant reductions in things like skin integrity problems with our patients. We've seen reductions in things like ventilator-acquired pneumonia problems. In fact, we've hardly had one of those cases now in the last 3-4 years. In terms of just infection rates and that kind of thing, we've actually seen some significant reductions in infection rates.
I learned every day something I didn't know the day before that I can take away and use someplace else. The valuable information that I learn each place is different from place to place, but mostly it's the commitment at the local level that I learn about and the desire for education, training, and resources to perform.
When people show up in the organization and they say, I want to work for you because I know that if I come here or my family comes here or my neighbors come, we're going to be well taken care of and we're part of making them better. That's how you sustain it. It's how you get everybody to buy into it and say, it's about the patient, it's not about you, it's not about me, but it's about our patients.
The leadership is what sets the standard for everyone below you. And so we need strong leadership. We need CEOs who care about the community one patient at a time. And I would say to them, if you're a CEO or a board member and you don't get it, I'm sorry, but it's almost 2013. Perhaps that's not a seat for you.